Hi, everyone. My name is Cheyenne. I'm the event manager at SimplePractice. Thank you so much for joining us for today's Ask a Biller webinar, where we'll be walking through some of your questions on billing for couples therapy. Before we get started, there are a few things I want to mention. First off, we're so excited to have you here today for this webinar. We'll be hosting many more webinars with Barbara and others throughout the year, so keep an eye out for the upcoming webinars to pre-register. Speaking of Barbara, we're so excited to have her with us here today. She's hosted this series with us for a couple years, and our customers need her wisdom more than ever. And now we'll just get started with the agenda. So we have an hour here today. We're going to start with introductions, and then we'll get through some of your pre-submitted questions. And then we're going to leave some time at the end to answer questions live that you can actually submit on the right-hand side in the Q&A panel. So if you take a look on the right-hand side of the screen, there's a Q&A panel, and feel free to drop any questions you have there. If you're experiencing any technical issues or have any questions in general, feel free to write those in the chat panel that's also to the right of the screen. This webinar will be recorded and will be sent out to you via email tomorrow. And it's also you'll also be able to view it on demand with the link that you're on right now. And that will be right after the webinar has ended. You can access the on-demand recording. And I'll let Barbara introduce herself, but before I do, as a reminder, if you are a SimplePractice customer and have any questions related to billing or insurance within your SimplePractice account specifically, I recommend visiting support.simplepractice.com. From there, you can view our entire library of resources and contact customer support directly. Reminder, SimplePractice does not provide insurance, billing, or legal advice. All views and opinions expressed by the presenter are not those of or endorsed by SimplePractice or its affiliates. And with that, I'll hand it over to you, Barbara.
Well, hello. Hi. Welcome, everyone. It's wonderful to be here and I'm always honored to speak for such a lovely group of folks, SimplePractice, and to all of you. So who am I? For those of you who don't know me, I am author of Navigating the Insurance Maze, the Therapist's Complete Guide to Working with Insurance and Whether You Should, which is now in its 9th edition, newly out and updated. So I hope you'll take a look at that. I've been in practice 32 years in private practice. So I've been in the trenches with you folks, with working with dozens of insurance plans. And now I provide trainings to groups and individuals nationwide or individual consultations to all of you who are having questions about insurance, documentation, practice building, all that good stuff. And I say, the stuff you never learned in grad school, right? So if you feel like you don't understand a lot of the things I'm talking about today and that somehow you should have, that everyone else knows it, that's not the case. Most of us just didn't get good training about billing and documentation. So don't feel bad for something that most of us never got. So glad that you're here and you can get a little bit of training. And my goal is to help therapists feel as confident about their businesses as they do about their therapy. Most of us feel we're pretty good therapists, but not so good feeling about sometimes the business side. But again, why should we? We never got much training in that area. All right. So now we're going to take the pre-submitted questions and answers. First section I kind of lumped together were about coverage for couples therapy. So the first question, I've heard insurance doesn't usually cover couples therapy, couples counseling. Is that true? Well, this is a myth that is out there, and I'm not really sure how it got started. It's very rare that insurance plans don't cover couples counseling. I've seen it a couple times in my career, but for the most part, insurance does cover couples counseling. And we'll talk about when it does and when it doesn't. But it's usually true that having two people in the session working on their relationship is a covered benefit, again, in certain cases, which we will talk about. So this is not true that insurance doesn't cover couples counseling for the most part. Okay. So when is couples therapy covered? Great question. Sometimes we think couples therapy is never covered because it's focused on relationship issues, and that individual therapy is different. That's more focused on, a client's anxiety or depression or something like that. And that's not necessarily the case. Couples therapy is covered for when the same criteria is needed when individual therapy is covered. I didn't quite say that right. Basically, you have to jump through the same 2 hoops to cover individual therapy as you would for couples. And what are those 2 hoops? Number 1, someone in the room has to have a diagnosis. And that diagnosis typically has to be something more than a Z code. Remember, Z codes are what used to be called V codes in the DSM. Those kind of phase of life issues, those parent-child problems, conflict in primary relationship issues. It usually has to be more than that for insurance to cover it. But that's true for individual therapy too. There's nothing special. If a client comes in and just wants to talk about issues with her husband and really has no anxiety or depression or substance abuse or even an adjustment disorder, which is usually covered, that's fine. It's the same thing with couples. So I don't know why we think differently about couples. So somebody in the room who's a covered member of that insurance plan needs to have a diagnosis more than a Z code. So what's the second criteria? The second criteria is you have to be able to make an argument that the service you're providing, in this case, couples therapy, can address that particular diagnosis. So if I can argue to myself that the communication work I'm doing with the couple or the whatever type of service I'm providing with the couple could aid in the identified patient, we'll talk about that in a minute, anxiety or their depression or again their substance abuse. If I'm in any way treating that diagnosis and I can make that argument, then it will typically be covered by insurance. Okay. And in fact, and let me go further because somebody asked about Medicare. Medicare will tell you that they don't cover couples therapy again or family therapy, but they do if you can argue that you are treating some person in that room's diagnosis and that the couples therapy or the family therapy is in service of treatment of that person's diagnosis. So, I'd use it sparingly and make sure you really have a good argument and that it's a very clear line between the diagnosis and the service you're providing. But it is covered. And I have a slide later that hopefully we'll get to that actually lays out exactly what Medicare covers. Okay. I've been told that one member of the couple has to be the identified patient. Is that true? I'm not comfortable with this. Yeah, this is a big one for us. A lot of couples therapists just feel completely uncomfortable with the idea of, if I make this person the identified patient for insurance, how is that going to come across to my client? That's not how I look at this. I look at this from a systems approach. And I would say probably everyone out there listening to this has a systems approach in terms of seeing that there's not one person who's the problem and the other person's not the problem. And I would think that all of us are kind of uncomfortable with the idea of an identified patient. But I guess insurance just needs one person for you to say that somebody in the room has a need for treatment and that it is addressing some medical issue. So we have to meet that, hey, is this covered? Is this just personal growth work that's going on? Is this clients coming in and saying, hey, we're getting married next month and we just want to make sure we are compatible and we really don't have any distress or any anxiety or any depression? Well, that's great that they're doing that work, but it's not something that insurance will cover. So if you're trying to build insurance, you have to always say, is this personal growth work, then it's not going to be covered. If there's some kind of medical diagnosis, then it will be. So yes, you have to choose a member that's going to be your identified patient. But the way I think of it and the way I explain it to clients if they have questions is that just one person's name has to go in the box. They don't have a way on the claim form to put down two people's names, or else I would do that. And they just need one person to meet the criteria that at least someone there is going to be billed it under, and that's all. So that's how I explain it, and that's how I'm comfortable with it. So how do I choose an identified patient? Like, what if both of my people have diagnoses? And do they have to? No, they don't both have to. Just one person in the room has to have a diagnosis. Now, what if both of them do? You can do that a number of ways. You can just choose one, eeny, meeny, miny, moe, rock, paper, scissors. Or you can, I sometimes will choose the person who has the richer insurance plan, who's going to give them more benefits, or that, maybe they have a lower copayment. I mean, that's fine. Maybe one of the clients will say, I don't want to be the identified patient. I have a security clearance at my top secret job, and I really don't want this to be under my name. So sometimes the client will have a preference. And sometimes I will choose the person who has just kind of more severe symptoms so that we may be able to go longer. And if I have to defend longer treatment, it would be easier to defend longer treatment under that person's name. So those are some things to keep in mind, but there's no necessary right or wrong. And I don't think I say this later, but they don't have to be covered members of the insurance plan. Just as long as your identified patient is covered under a insurance plan, they can bring in anyone else to the session. So does the couple have to be married? Do both members of the couple have to be covered by the insurance plan? Oh, I jumped there. So I just answered the second part there. Both members of the couple do not need to be covered by the insurance plan. Does the couple have to be married? No. In most cases, insurance plans don't even need to know who the other person is when you're billing. They can be married. They can be just a significant other. It could be a boyfriend, girlfriend, could be a caretaker. Any person who is a significant person in their life is fine. They don't usually have restrictions on that. How is diagnosis different with couples therapy? Are there diagnoses that are not covered? How do I bill if neither partner has a diagnosis? So these were 3 different questions that we got submitted about diagnosis, so I lumped them together. How is diagnosis different with couples therapy? Okay, so as we said, it kind of isn't in some ways. You are still in your intake looking for, does someone in the room have depression, anxiety, substance abuse, adjustment disorder? Are they adjusting to them? So you're doing the same thing you do in an individual intake, which is looking for who in the room has symptoms of what, and you're doing your diagnostic evaluation. And it's pretty much the same as individual. You're going to pick somebody and you're going to write down their diagnosis, and you're going to create a treatment plan around how you are going to treat that diagnosis. Are the diagnoses that are not covered? Great question. For the most part, the same diagnosis will be covered as in individual therapy. There's only a few diagnoses I can think of that are sometimes not covered. It really depends on the plan. But sometimes sex, basically any diagnosis that's about clients having better sex may not be covered. Again, they don't see that as medically necessary or, something that has to happen. That's more like, hey, clients want to be happier. They don't necessarily cover happiness. They tend to cover, a symptom that's a medical symptom like anxiety or depression. And how do I bill if neither partner has a diagnosis? Well, you don't bill insurance for that. If you've done your scanning and you can't come up with anything more than a Z code, you could try putting in the Z code, but I would be telling the clients, yeah, I don't think they're going to cover this. And you could even call the insurance if you want. But if neither partner has any diagnosis, I would not submit an insurance bill. You definitely don't want to put down a fake diagnosis or one that you want to trump up just so they can get covered, because that's a fraud. And certainly it doesn't role play good ethics to your clients either. All right, how about some questions about coding? This is a big area that I get asked a lot. What CPT codes should I use for couples therapy? So what's a CPT code? That's the 5-digit code that you use on your claims or on your super bills if you're out of network, that tells them what kind of service you provided. And there's different CPT codes for individual sessions, and there's ones for couples sessions. So I'm going to have you at home. We're going to do a little quiz, see if you can get these right. So let's look at some scenarios. What CPT code would you use for session 1 when you see a couple together for an intake? Just think about it. You can write it down if you want to, but think about it for a minute. You're just seeing a couple together for an intake. What code would you use to bill the insurance for that? Okay, how about the session 2? You decide you're going to want to see the identified patient alone. This is how you work. You meet with each one of them. You meet with them together in the first session, and then let's say you see the identified patient alone. How would you code that session? And then in session 3, you see the partner of the identified patient alone. And remember, he doesn't have to be covered by the insurance plan directly, because you're going to bill under her name. And then session 4, you see the couple together again for therapy now, not an intake session. Okay, let's see how you did. So session 1, you had that couple's intake. That should be CPT codes 90791. That 90791 should be used for all your first sessions with individuals or couples. It's a history taking. It's called a diagnostic assessment. It's basically just, hey, this is our opening session with somebody. And there's some good arguments to using that code. Some of you don't use that code ever, but sometimes you can get paid more, or our clients can get reimbursed more for that particular session. So good to use that one. It doesn't have a time frame on it. So if you do a 3-hour intake versus a 15-minute intake, that's the same code. Okay, session 2, you saw the identified patient alone. A lot of people get this one wrong. This is an individual session. You need to code it such. So 2 of the most popular individual session codes are 90834, which is technically called a 45-minute individual session, but it actually spans from 38 minutes to 52 minutes. So if you did that length of time with this identified patient, then that's the one you'd use. If you you would use code 90837, and that's the code for a 60-minute individual, but technically it's 53 minutes and over, which we'll talk more about longer sessions. So don't flood the chat yet about that one, or the question and answer. In session 3, you met with a partner alone. This is a tougher one. And the CPT code for that is 90846, which is a couples or family session without the identified patient. And that has the time limit of 50 minutes, or it's assigned a time in 50 minutes, but actually it's 26 minutes and above. So you can even do a 26-minute session and bill for that and get paid the 50-minute. In the 4th session, you see the couples together. And this is, very clear, needs to be a 90847, which is your couples or family session. Again, 50 minutes, but with a 26 minutes and above technical use. So I hope you guys did well on that. And, This may not be how you were taught. Some people use the 90847 for all of those sessions because they were all they see it as part of the couple's work. But you actually have to really tell the insurance plan when you're doing different types of sessions in there. All right. Some insurance plans pay less for couple sessions than for 90837 60-minute individual session. Can I just use the 90837 for couple sessions? Now, right now, I'm imagining all of you nodding your head. This is a huge complaint among us. Why they could possibly pay less for a couple session than for an individual session blows all of our minds. It seems absolutely insane. And I always say you should get extra hazard pay for dealing with couples and families. The answer cannot be that you use 90837. That is a clear incorrect coding. And I have seen it happen. That is clearly to be used only for individual sessions and not for ongoing couples sessions. The only time you can use a 90837 for when there's more than one person in the room is if you have your individual therapy hat on and you're doing ongoing individual therapy, let's say with a kid, and you bring mom in for the end of a session every time for 15 minutes or maybe once a month you bring in mom or dad to just kind of tell them how things are progressing. But you're not doing ongoing couples and family sessions. So the 90837 can stretch a little to accommodate someone coming into individual therapy and just kind of telling you how it's progressing, but it cannot stretch to the point of ongoing couples or family sessions. So no, you cannot use 90837. And I have seen people get audited for this and have to give back tons of money because they used the wrong code. And not something you want to see happen for you. Why do many insurance plans pay less for couples therapy than they do for individual therapy? Well, your guess is kind of as good as mine, but I think it's because for some reason they made it a 50-minute code. The 60-minute code is sometimes looked at, the individual code is sometimes looked at as an extended session. And so they've some reason made the couples therapy and family therapy codes 50 minutes. So I think they're paying according to the time frame. What can you do to change this? Great question. Certainly, there's not a lot we can do. Insurance plans can set their own rates. So I don't know if there's a way that we can band together and fight them. But you can, many people don't realize you can ask for a raise. And you can ask for that particular code to get a raise for if you're happy with your other codes, or you can ask for raises for all of the CPT codes that you provide if you are in network. If you missed last month, 2 months ago, we did a webinar for SimplePractice on raises and rates and resignations. So, at the end, we'll talk about the Ask a Biller series and where you can get that recording. But many people aren't aware you can ask for a raise and how to go about that and what to highlight. That's all in that webinar, which is, again, free and at the Ask a Biller site, which we will give at the end. All right. I sometimes do couple sessions that are 90 minutes or longer. Is there any way to get paid more for these sessions by insurance? This is like the biggest question that I get. Let's talk about that. So many of you are aware. Let's say you do a 100-minute session or something in that range. What are your coding options? Well, you used to be able to try what's called prolonged service codes, but many of you are acutely aware, that those were deleted as of the 1st of 1/1/2023. Some of you were billing using these codes 99354, which I won't go into a lot since they're gone, and 99355, and you were getting paid extra for them for longer sessions, and you were thrilled. And some of you really relied on it, depending on the type of services you're providing, if you're often providing prolonged service codes, this can be a real change in your income. I want to be really clear that these are deleted. You can't use them anymore. They were not replaced. I have a whole article on this, which I will give you the link. And, so this has left a lot of us high and dry with not a good way to bill insurance for longer sessions. So the second question you can ask yourself is, was it a crisis session? If it was a crisis session, we do have some special codes for that. We have the 90839, which is the first 60 minutes of a crisis session. And then when it goes past that, you can use the 90840 add-on code, which means you can only add it on to the 90839. You can't just add this to other therapy codes. And that's for each additional 30 minutes of crisis. So if you have a 2-hour session, you could bill for a 90839 and then 90840 for the 30 minutes past it, and then another 90840. Now, whether insurance is going to pay for all of that, they might not, but these are codes that are there for that you could use. Now, number 3, some people ask, well, can I just bill for 2 90847 couples sessions in the same day? Will that be paid? I'm here to tell you probably not. I've almost never seen that happen. Most insurance plans have a maximum of 1 hour of or 1 unit of any code that you put down. So I've been told by a couple people around the country, like, hey, I did 90837 and I did 2 units and I got paid, but it's very rare. Most insurance plans seem to will pay one and not another. So if you put 2 units, they might deny the whole thing. So it's kind of not something that I think you're going to be successful at. So here's the big question I get. So if I'm a network therapist, can I bill the plan for the first 50 minutes that they will cover and then ask the client to pay the rest? And this is a big possible. This is maybe. I mean, you certainly have to check your contract and see if there's anything that forbids this. But it is kind of a gray area that's not covered by many contracts. Sometimes the contract will tell you can only collect from the client their copayments and their deductibles, and it really doesn't sound like you can collect other things from them. But and if you call, which I have called before and talked to some vice presidents, and they say, well, I guess we would support you if you have it in writing from the client that they agree to pay for the second, basically the second hour. So what I'm giving you as a gift for showing up or for watching this is that I'm sharing my self-pay agreement that covers this. So basically it's an agreement where the client says, hey, I understand you're only going to bill insurance for the first hour or first 50 minutes of our meeting together, whatever. And this can be used for individual sessions too. And then after that, I am having to cover whatever the remaining amount is. And I understand you're telling me what the rate is, and I agree to that rate. And kind of just lay it all out that the client agrees to that extra charge. If you're out of network, you're already just collecting the whole amount and you're just giving them a invoice or super bill for the 50-minute couple session, right? Even though they paid for a longer one. So this self-pay agreement that I'm referring to, I have put it on what I call my landing page, which is the post webinar page, which I'm putting some good resources on there for you. So if you go to theinsurancemaze.com/SP couples, and maybe Cheyenne can put it in the Q&A so that you can copy the link. Are you there, Cheyenne? Hello.
I'm here. Yes, I'll drop it in the chat right now.
Oh, in the chat. Okay, she's going to drop it in the chat, so you have that link. And you can download my self-pay agreement for free there and adapt it for your uses. Also, and that link is going to take you to a place where you have to enter your email address, and then it'll take you to the page instantly for the download. And also on that page, I'm going to be putting, or after you put in your email address, you can see a link to my article on billing for longer sessions. And we'll go into this in much more depth on that page about your options. Okay. I'm sure we're going to get more questions about that, but let's look at law, ethics, contract violations, and fraud. I lumped those together. I'm in network with many health plans, but the rate these plans pay for couples therapy is too low. Can I just tell couples that I'm not going to bill insurance for couples therapy? Okay, so again, this person's in network with lots of health plans, but the rate that the plans pay for couples therapy is too low. Can I just tell couples I'm not going to bill for couples therapy? I can't tell you how many times I've heard this, or I've heard from therapists who are already doing this. I would say that in most cases, this is a contract violation to just before you've even assessed the client to say, I'm not going to bill for couples therapy. Now, these therapists tell me, well, I feel like what I do is relational issues. It's not to address a diagnosis. I don't even want to go down that path. I feel like I have good justification for saying that we're focusing on relationship and communication issues, and it's not a reimbursable thing. I guess how I feel is that you haven't really taken the time to assess whether this couple has something, even if they're telling you they're coming in for just couples communication. You come in and maybe you assess that this person has anxiety or that this person has depression, or we go back, substance abuse, so that they're adjusting to a new baby or something. So it may be after assessment, you would be able to say this person actually does have something more going on, and that their insurance really could be used to cover this. And I feel like if I am on that health plan, I owe it to the clients to assess, and if their benefits could cover this, then I justifiably have to, give them the benefits of their plan. So I guess I'm uncomfortable with this idea that we're going to not even assess people and we're going to just tell them ahead of time, I'm not going to bill. In your contract, it was probably on your fee schedule that you are covered to provide that particular 90847 service code. And basically you're telling clients who come to you, I'm not going to provide that service for you, even though it's in my contract. So I would say, no, I understand where you're coming from, but I would encourage you to try to get a raise or consider whether you feel like you can continue with the health plan. I get the income thing, but it does feel a little bit wrong to me. And it does feel like a contract violation to me. I see a husband and a wife. They would like me to give them each an invoice or super bill so they can both bill their separate insurance plans for the session. They call their insurance and were told this is fine. Is this really okay? Think about this and think about what your guess is for this one. Okay, so the answer is no. You cannot give two people from the session an invoice or a super bill for them to bill their separate insurance plans for the session. So this is another one of those wonderful cases where insurance gives really crappy, unethical advice. Don't always trust the insurance plan to tell you how to run your practice. They're not clued into ethics, and unfortunately, you're now put into a triangle between what the insurance plan told them and you. But basically, this is double dipping, double billing. They've basically only paid one amount, and now they're going to go and take an invoice or super. Let's say they paid $100 for the session, and I'm going to give the wife an invoice for $100 and the husband an invoice for $100, and now they could potentially collect $200 for a session they paid $100 for. First of all, not okay. That's fraud. And number two, you're double billing for the same session. You're submitting two. So it's going to look like insurance fraud from your point of view, that you were trying to make it so that they could double collect. So you don't want to pull this one. My client's plan doesn't cover couples counseling. Okay, this is very rare, but it does happen. An insurance representative told us it was okay to use 90837 for couples counseling. That's that individual code, 60 minutes, since the plan didn't cover 90847. So if the plan advises it, is it okay? If not, can I charge my full fee for the sessions? Ooh, good question. Let's review it. We've got a therapist being told that the 90847 is not going to be covered, the family and couples therapy. So the insurance rep is saying, go ahead and use the individual code. So if the plan's telling you that's okay, is it okay? And of course, this is another one of those where no, it is not okay. Yeah, they can tell you that, but again, if in an audit, you could be asked to pay thousands of dollars back because you misrepresented the code. And you're not going to be able to say, well, your person told me that. No, that's not going to help. So you have to use the accurate code that represents what kind of service you provided. That anything other than that is a fraud. So you always have to just be super conscientious about your codes. So if not, okay, so let's say the plan doesn't cover 90847. Can I charge my full fee for the sessions? So this is a person, let's see. Yeah, if it's a non-covered service, you should be able to charge your full fee for the sessions. Basically, insurance is saying, hands off, we're not covering this item. So if your client is buying services that they're not covering, you should be able to then think of them as, kind of like private paid clients. And then you should be able to negotiate your fee or charge your full fee. If I do a 90-minute couple session, can I bill the first 45 minutes to one client's insurance and the second 45 minutes to the partner's insurance? Another great question that I get a lot. And I would say, sure, you could, and you probably wouldn't get in any trouble, but you could get in trouble for it. I mean, if the insurance plan ever kind of figured this out, that you were just trying to get around the fact that they don't cover 90-minute sessions, and that you are doing this, anything where you're kind of feel a little bit like, I'm not sure if this is okay, probably isn't okay, right? There's a couple things that would be cropping up. Am I going to have to defend to an insurance plan if they audit me that, yes, for the first 45 minutes, we really kind of focused a little bit more on the wife's issues. And then the second half, we suddenly, in the middle of, after 45 minutes, we stopped and we really kind of used that second part to focus on the other person's issues. And that couldn't have been, both their issues couldn't have been covered in 45 minutes together in a couple session. And then how are you going to document that? Are you going to put them both down as in two different charts? And you're going to have start and stop times for each one of those sessions. And you're going to have separate treatment plans. It just feels, as soon as I start feeling like this is like a dance that I'm trying to do, obviously, to either help my clients get reimbursed more or trying to get me reimbursed more. If that's the sole thing, it's usually not a good idea. And I would feel uncomfortable with this. It's risky, I would say. So I don't know that I would encourage you to take the risk. If you're both seeing couples in other states, do you both need to be in a state where you're licensed to practice? Ooh, good question. The short answer is yes. You either need to be, whenever you see somebody in another state, you need to either be licensed or permitted to practice in the state where that client's feet are at the time of the session. So wherever they're located at the time of the session, doesn't matter where their residence is, you need to be licensed, or you have to check in with their license board and say, hey, if I'm an MFT, I have to check with the MFT licensing board in that other state and say, hey, can I be permitted to practice either temporarily? Can I get a temporary license? Can I read it? What are your rules for practicing across state lines? And many states forbid it completely. Some have allowed a temporary practice during the pandemic, but that has expired. So they all have different rules. And even within the same state, they have different rules for different licenses. So you're going to have to check into that. But in general, and what this one addresses is, do both clients or just maybe my identified patient, who needs to be in a state where I'm licensed? And it's both. Because basically you are practicing in both of those states. If you're seeing your husband's in one state and your wife's in the other state, you are considered to be practicing in both of those states. So you need to be licensed or permitted to practice there. Now, one person told me that they contacted the licensing board and kind of explained the situation, and they got like permission for like an exemption for their particular situation because the husband was in another state. So, even if the rules are not good or in your favor, you might call and just ask if they might make an exception. Couples usually seek help for relationship distress. Is it really ethical to bill insurance for a higher diagnosis like anxiety or an adjustment disorder? This kind of goes back to diagnosis here, right? A lot of therapists I know throw down an adjustment disorder on all their clients, especially their couples, or just sort out an anxiety diagnosis or just something to. And I've gotten lots of questions where people are like, hey, what code do I put down and what diagnosis do I put down so that they get paid? And that's the wrong question. Don't ask. You should be asking, what do these people have going on? Do they meet the criteria for a diagnosis? And if so, can I really justify that? If I was ever questioned in a courtroom or, by a evaluator, could I back up that adjustment disorder, or can I back up that anxiety disorder? And if you can't, then you really need to tell the clients, hey, I'd love to do this work with you. I'm really excited to do this work with you. It's great personal growth work on your self-esteem or your self-confidence or whatever, or your communication. But I do need to tell you that this is not something that your insurance is going to be able to bill for. They don't cover this type of, therapy or counseling. So let's discuss, what that would cost if you did not use your insurance. All right, question about documentation. How is documentation different with couples? Do I need to keep 2 progress notes, 2 charts, 2 treatment plans? Everyone does couples therapy documentation different, it seems to me. I tend to keep it in a blended chart. You don't need 2 progress notes if you're doing ongoing couples therapy. You don't need 2 charts. You don't need 2 treatment plans. 1 treatment plan for the identified patient. And your treatment plan needs to be just a little bit aimed at the identified patient, unfortunately. And I know that that's not how we look at it, but if you're diagnosing your identified patient in the couple as having anxiety, or adjustment disorder with anxiety, then maybe your first treatment goal is reduce client anxiety. And then, second treatment goal might be, helping clients communicate more so that she can better make husband aware of how he can be helpful when she's anxious, or work on, in couples therapy, work on this particular thing so husband can respond more effectively to her anxiety. So I know that we don't love the idea of making the treatment plan kind of center on one of the people, but it's, again, one of those little hoops you jump through, I think. And that doesn't have to be how you come across to the clients. And I explain to clients, I have a different informed consent that tells them this, what tells them a little bit about choosing identified patients, and that's not how I look at it, and secrets policies, and covers all kinds of different things about couples that don't have to be in an individual. All right. And if time, oh, good, we do have time. So we get to that question of, will Medicare cover couples therapy? I touched on this at the beginning, but I just kind of wrote it out for you, and I copied this right from the Medicare manual. Couples therapy is covered, quote, when maladaptive behaviors of family members are exacerbating the client's mental illness or interfering with the treatment, or to assist the family in addressing the maladaptive behaviors of the patient and to improve treatment compliance, only when the primary purpose of such therapy is the treatment of the client's conditions. For example, to observe and correct the client's interaction with family members, to assess the conflicts or impediments within the family and assist the family members in managing the client. I know it sounds very derogatory to the client and blaming, but just keeping in mind, the term family may apply to live-in companions or significant others involved in the care of the client. So they're very clear, can be anybody pretty much. So this is all very formal way of saying what I said at the beginning, which is if you can make an argument that you are trying to treat the client's condition, which may be, let's say, anxiety, and that you feel that there's a direct connection between bringing in those family members, that couple, and that's going to further your ability to treat the anxious family member, then go to it. So that's just something to keep in mind. And again, that's from the Medicare manual. So it's not like my opinion. All right. So before we take live questions, I wanted to go over the 2 freebies that I'm offering at that landing page, which is highlighted there in yellow. theinsuranceMaze.com/SP for SimplePractice couples. I'm giving away a fair fighting rules handout, which I love to give my couples, and teaches them how to fight fairly. Sometimes they feel like it's not okay to fight. It's definitely okay to fight, but you got to behave well. And here's the rules. And I find it a really helpful handout. It generates a lot of really good discussion. The other is the self-pay agreement I talked about earlier. So if you do extended sessions, or if you're contracting with a client to pay out of pocket when they actually have insurance, there's lots of other things on there. If the insurance won't cover what they want, there's all kinds of topics there, but for extended sessions, there's a whole section on that. So you can download that for free. I have other great resources, and we're talking about the next webinar that's coming up. And you can join my mailing list so you can learn about all kinds of good stuff. And I'm also have my contact information at the bottom of this slide, which we will come back to. But in case you want to contact me or check out my resources on my website. And before we take live questions, we want to, Cheyenne's going to tell you about this.
Yeah, so just as a reminder.
I'm sorry, I keep mispronouncing your name, Cheyenne, right?
No worries. Just as a reminder, the entire Ask a Biller series can be found on simplepractice.com/askabiller series. And then as another reminder, this webinar is being recorded and will be sent to you via email along with the webinar slides. You can also access it with the link we're on now. And Barbara, you can talk about the webinar we have.
Yeah, so we do these Ask a Biller things every 2 months. And the next one we have planned is all about audits and records requests, what you need to know. So really important. So that will be May 3rd. Mark your calendars, but even better, you can register now so that you don't forget. And the link is up there, tinyurl.com/SP audits. I'll also have that on the landing page, and maybe take a minute to, are you going to put it in the chat for them too?
Yeah, I'll place it in the chat. We'll just get moving a little bit quickly. We'll come back to this slide after. Let's just get started with the live questions. We have a ton here today. All right. So the first question we have is from Tara Leah. If a couple session is scheduled, but only one of the clients shows up, that session should be billed as an individual session, correct?
Great question. Yes, because what the service, you just keep coming back to, what is the service I provided? I didn't provide a couple session. I provided an individual session. Yeah. But it's a great question. What if it's an uncovered member of the session what if that person doesn't have, are you going to bill it under their, well, let me just say this. If they're the non-identified patient who shows up, you're probably going to have to use the 90846, which is that you met with the non-identified patient without the patient present. If it's the identified patient who showed up, then you can bill an individual therapy and under their name, right? So both ways you're going to bill under the identified patient's name for the session, but whether depending on who showed up, you're either going to bill an individual session if the IP shows up, and if it's the non-IP, you use the 90846.
Okay, and next question comes from Zoe. Is the IP the only one who has access to progress notes, etc.?
Great question. So it depends how you set it up. Most of us consider both of the members of a couple our clients, and you have everybody hopefully sign, both members signing all your intake paperwork with your policies and this and that. So I have everybody sign all this. So in that way, you have told them basically they both have confidentiality rights. They both have rights to the progress notes. So they both basically are your clients, even though you're having an IP for the insurance. Legally, they have access to the progress notes. Now, there's lots of things where you have to release them to one of them, you have to get the sign off from the other person, right? Because they're both your client. So it depends on your state, but for the most part, if you're in a state like California here, we would need sign off from both of them to release it to either one of them or to a third party. Or you can set it up that one of them is the collateral and not your client. And then you have one client and a collateral, and the collateral has no rights to progress notes, confidentiality, all kinds of stuff, which I don't really feel like is great. But if that's true, you have to set up a whole different collateral agreement at the beginning where you outline to them, hey, you don't have these rights, you have these rights. And so you would need to set it up quite differently. There are collateral agreements out there. So if that interests you, look into that.
All right, we'll move to the next question. How is a crisis defined by insurance?
The good thing about, if you're thinking about the crisis code, the good thing about the crisis code is that it's really your definition. If you're using the 90839 and 90840, they pretty much will allow you to defend it. But, they could argue with you that you used that, and then they come back and they're like, there was really no crisis at all. We really don't see anything here. Like, this person stubbed their toe. We don't think that's a crisis. So you can use it and you can bill it. But if you're audited and they really think you shouldn't have used that code, they could go back and, ask for money back. But I think if it's a very clear crisis, somebody finds out that they're pregnant and they're falling apart, or it can be somebody found out that they're they told you that they were abused, and you have to do a report. So something like that. There's some suggestions, but it's really kind of up to you.
Okay, next question from Kristen. How do the CPT codes change for telehealth appointments?
Yeah, great. And I have a whole webinar on telehealth, but basically it's the same 5 digits that if you saw the person in person, you don't have different ones for telehealth. The only thing that's different, so let's say if I see somebody individual on the screen for a telehealth appointment, it's going to be those same codes we talked about. If I see a couple, we're going to use those same codes. However, the differences are going to be that there's 2 ways that you are telling the health plan that it was a telehealth appointment. Otherwise, they wouldn't know. There's something called a place of service code. And if it's in person, you are going to use 11. If it's a telehealth code, you use a 10 if the client was at their home, and a 02 if they were somewhere else. It used to be 02 for everything. Now this is the new, except if you're Medicare. Medicare is still using the 11 for everything. And I encourage you to keep using that until the end of at least to the end of this year, to 2023. They may switch, but so the place of service code and a modifier that needs to go after the CPT code. So I encourage you to use 95. Most health plans, that tells them that it was a video appointment. They're starting to use 93 for phone appointments, but not all health plans have accepted that yet. So check with the health plan. And There might be one health plan that doesn't want 95, they want GT. That's an older one. You can still use that one, but there's one plan that won't accept 95, and that's Regents. But always check and see what the codes are that particular health plan is accepting, and it may change.
All right. Next question is from Menachem. In the case that you use couple codes for all the sessions, why would you lose all the money instead of correcting the codes?
Case that you used couples codes for all sessions, why would you lose all the money instead of correcting the codes? I'm not sure I understand that one. That you used couples codes for individual sessions? What money would you lose? Maybe this person's saying that you used individual codes.
It might be when they're getting audited, I believe, is what I'm seeing in the chat. But we can come back to this one.
Okay, sorry.
Good. Next question from Colby. What's the most effective way to request or argue for a raise? And I know we covered that in our
we just had a whole webinar on that. I think that one's better that you watch the webinar on that, because it's going to talk about things to highlight, what the steps are, and it's free to you and it's available. It's a quick 1-hour webinar, just like this one. And it will tell you the steps and give you a sample raise request letter, I think is in there. So it's got some really good stuff. So it also, you can contact me and I can coach you on asking for a raise. So
we'll do a couple more here. We're almost running on time. We have one from Victor. Can a client opt to pay cash for a provider who is a provider for their insurance company and not have their insurance billed?
Yeah, great question. A client can come to you and say, I have insurance, I don't want to use it for X reason. I don't want the confidentiality breach, or I don't want them to know that I'm in treatment or whatever. And I don't want to use my insurance. And in that case, you're going to get that private pay agreement there that I'm giving out for free. And the first one there is, hey, I have insurance. I think the first one, and I don't want to use it. And I waive you billing, and I understand I have to pay out of pocket, kind of thing. Yes. So they get to waive. I think that's in there. They can do that. What you can't do is say, hey, person who's come to me, I see that you have whatever Blue Cross insurance, and I'm a Blue Cross provider, but I don't want to take any more Blue Cross people, or I'm not taking any new insurance people, so you can pay out of pocket and see me. We can't like steer them and not give them the benefits of their insurance plan if we are a network provider. So you can't kind of turn them into a private pay client. Hopefully that makes sense.
Yeah, and I think we're running close to time, but we can take one more question really quickly.
Okay.
We have one here from Jonathan. Is there a successful way to bill individual sessions and couple sessions on the same date? The 59 modifier doesn't always allow for this.
Yeah, I mean, sometimes insurance plans don't allow more than one session on the same date. So you just have to know that, and you can list them both and you can try. But you're right. I would use the 59 modifier, and if they're going to pay, the 59 modifier just tells somebody, the insurance plan, that these sessions were separate on the same date and that they weren't done at the same time, which seems odd. But so yes, you would put a 59 modifier after the second. And if it's not allowing for, if they're not covering it, I don't know what doesn't allow for this means. That is actually the right modifier, but they may not cover it. We can't promise that they will cover it. So yeah.
Got it. Well, we're coming up here on time. Thank you so much, Barbara. Thank you, everyone, for joining. We hope it was insightful and informative, and we'll share the recording and the slides, and we look forward to having you all here at our next one. Thank you again, Barbara.
Bye. Thanks, Sharon.